This is a long one, so buckle up. As I was laying around the house yesterday, nursing a sick tummy, I remember the conversation that was taking place in regards to the Affordable Care Act and Obamacare, and how a lot of people who get their health care through the Affordable Care Act, they didn't realize that that was Obamacare. And so you had a lot of white Trump supporters who are freaking out about losing the Affordable Care Act. And so in thinking about that, I was like, how many people don't realize that they are on Medicaid because each state names their Medicaid health insurance program something different, something other than Medicaid. So I put this post out across all of my social media platforms on yesterday. And this post was made directly to my fellow Georgians. Georgians, if you have health care with CareSource, you have Medicaid. If you have coverage through Georgia Pathways, that is Medicaid. If you have Peach State, your insurance is managed by Medicaid. And I finished the post with, just thought it was important for you to know that you are in jeopardy of losing your health insurance. And in making that post across all of my social media pages, several of you got down in the comment section and added on to it from different states. If you have then you have Medicaid. States all across the country name their health insurance programs something other than Medicaid, but it is Medicaid. So just like those Trump supporters who were boasting out on Twitter saying, boy, am I glad that I don't have Obamacare because Obamacare is going away. The Affordable Care Act has been providing coverage for me and my family, and it's been wonderful. Only to learn that the Affordable Care Act is Obamacare. Imagine the amount of Trump supporters who were saying, boy, am I glad I don't have Medicaid, only to learn that their health coverage is Medicaid. Imagine all of the individuals who are now learning the truth of this situation. And in learning the truth of the situation, sometimes folks have questions. And this was a question that was left underneath that post that I made over on YouTube. It says, my white friend who needs Medicare to pay assisted living fees, will they get put out on the street? Well, let's look at the reality of this situation. The reality of the situation is that the majority of Republicans in the House, they have the power in the House. They brought forth a bill and they called it the One Big Beautiful Bill. They all signed off on it, passed that bill to the Senate. The Senate is also majority Republican. The Republicans in the Senate, they added more damage to the bill and then sent that bill back to the House. The people in the House, they talked a big game saying they weren't going to sign this into law because it was going to hurt millions of Americans. Millions of Americans were going to lose health care coverage. It was going to add $4 trillion to the deficit. They talked a big game, but then Donald Trump invited them all to the White House, gave them hats and T-shirts and took pictures with them. And they went on back to the House and they signed that bill. They passed that bill and sent it on to Donald Trump's desk. Donald Trump has signed that bill into law. And as a result of Donald Trump signing that bill into law, we're expecting major cuts to Medicaid and Medicare. $800 billion in cuts. $800 billion in Medicaid and Medicare cuts could affect your friend and their ability to pay those assisted living fees, which means your white friend who would use those Medicaid fees to pay for their assisted living arrangements, that could possibly mean that your white friend will need to find alternative living arrangements. Yeah. As we're having this conversation, I am reminded that the nice black lady, the qualified, competent, beautiful, educated, measured black woman, she had different plans for Medicare and Medicaid. So I went on over to Alfred. Alfred is Perplexity. And I asked Alfred, can you remind me what Kamala Harris's plans were for expanding Medicaid and Medicare and elder care and nursing home benefits? Alfred, can you remind me of that, please? And so Alfred went searching, went on over and searched NPR's articles and CBS News articles and skilled nursing news articles, and he brought back this nice little bullet-pointed excerpt for me to share with you. Because I certainly remembered Kamala Harris talking about expanding Medicaid and Medicare, and specifically talking about elder care assistance at home versus in a nursing home, but also expanding nursing home care benefits. And so let's read. I got it up over here on the big screen. Let's read what Alfred brought back after searching all of those articles. Medicare expansion, which equals her plan, Medicare at home. Home care coverage. Harris had proposed a major expansion of Medicare to cover long-term in-home care for seniors and people with disabilities. This would be the first time that Medicare would have broadly paid for home health aides to assist with daily activities like bathing, dressing, and meal preparation, not just after a hospital stay, but after a regular benefit. Who would have been eligible for this? The benefit would have been available to Medicare beneficiaries who cannot perform activities of daily living or have serious cognitive impairments such as Alzheimer's disease. The scope of the benefit? Well, the plan envisioned up to 20 hours per week of home care with cost-sharing requirements that vary by income. Vision and hearing? Kamala Harris also wanted to expand Medicare to include vision and hearing benefits, which were currently not covered by traditional Medicare. The financing side of it, the expansion would have been funded by increasing Medicare's ability to negotiate drug prices, expanding discounts for brand name drugs, and reducing inefficiencies in the prescription drug system. That's one of the ways that Kamala Harris was going to expand Medicare. And this policy idea of Kamala Harris, it was titled Medicare at Home. But wait, there's more. Kamala Harris also wanted to provide elder care and support for family caregivers. And here's more of what that policy entailed. Kamala Harris's policy. Y'all said she didn't have no policies. Yeah, y'all are liars, okay? This policy was to focus on the sandwich generation. The plan was designed to help adults who were caring for both children and aging parents, a group that faces significant financial and emotional stress. The goal of this policy: the elder care and support for family caregivers, support for the sandwich generation, for families who were taking care of young children and elderly parents. The goal was to enable more seniors to age in a place at home, which is both a preference for most older adults and a way to reduce the high costs associated with nursing home care. What would have been the impact of this policy? Elder care and support for family caregivers, the sandwich generation, families who had young children, they were taking care of young children at home and their elderly parents. Well, the impact was it aimed to relieve family caregivers, help them stay in the workforce, and reduce hospital admissions by providing more support at home. How would this policy or plan that Kamala Harris had, when y'all said she had no plans or policies, how would this have made shifts in the industry regarding nursing home care and at-home care and the family as a whole? What type of cost savings would have come about if Kamala Harris would have been able to put her plan in action? By shifting some care from nursing homes to home settings, the plan would have projected to save money for families and potentially for Medicare through an estimated cost savings of about $40 billion per year. Alfred rounds our conversation off with: Harris had signaled support for extending Medicaid coverage in the 10 states that have not yet expanded it under the Affordable Care Act, continuing the Biden administration's efforts to broaden access to health care coverage for low-income Americans. The Biden-Harris administration previously pushed for increased federal funding for both child care and senior care, and Harris expected to continue advocating for these investments. Harris's proposals represented a significant shift towards supporting seniors and caregivers with a focus on home-based care, expanding Medicare benefits, and continued efforts to broaden Medicare coverage. So to that commenter that asked if their white friend who uses Medicaid funds to pay for their assisted living facility fees, when you have the conversation, make sure you let them know that it was Republicans in the House, Republicans in the Senate who brought forth a bill for Donald Trump to sign into law that is going to cut $800 billion from Medicaid and Medicare. And also, commenter, include in that conversation that Donald Trump's opponent, Kamala Harris, make sure you let your white friend know what Kamala Harris's plans were. Kamala Harris's plans were to expand Medicaid and Medicare and the benefits available to recipients. Make sure you include that in the conversation. And to all of those leftists that are out there, the online leftists that are out there talking about Kamala Harris didn't have any policies or plans, you're all liars. You're all liars. Kamala Harris had policies and plans. Problem is, you weren't listening and you were lying to the people that follow you. And because you were lying to the people that follow you, they all followed your lead and voted third party or didn't vote at all or voted for Donald Trump. And now we all find ourselves in this position because of your ignorance.